From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
So thank you for joining us for this edition of Inside the 1581. I'm Rich Rasmussen. I am the CEO of the Oklahoma Hospital Association, and every 2 weeks we produce our podcast, Inside the 1581, trying to tackle some of the topical issues that we might be confronting here in our state, or it might be something that could be just kind of interesting that we want to be able to noodle out with folks. And so today is one of those that kind of looks at both. We're going to be talking to Barbara O'Brien, who's the director of the Oklahoma Perinatal Quality Improvement Collaborative. I kind of call them OP Quick, but we got to spell it all out. So Barbara, thanks for joining us today.
Oh, glad to be here.
And so I look at this issue. I'm a dad. So I have, 5 kids between my wife and I, and I loved being a dad. But my first interest in, taking care of moms and babies goes back when my first job right out of college. I had a chance to work in D.C. On the staff of the Senate Budget Committee, and our chairman at the time, Lawton Childs, was the founder of the National Commission to Prevent Infant Mortality. And so as a young staffer, I was given responsibility to help kind of create some media around the work of the commission. So spent some time traveling with him around the country doing field hearings and really, looking at what is being done successfully in many communities, the work that the Ounce of Prevention Fund early on had and others. It really did create a real interest in me on what we can do to do a better job for moms and babies. And so to come to OHA and have an opportunity to work with you and for your team and to be a part of our team and the work that we're doing in the Foundation for Healthy Oklahoma, it's kind of like coming full circle.
Yeah, well, that's very true that we can say that being born is a universal experience. And
very good.
Most people will give birth or become a dad in their lifetime. So it's it's an experience, childbirth, becoming a family that most people in the United States experience, and it's almost universal. So,
well, it is. There's certainly a lot of work to do in this space, and there's a lot to celebrate. So before we get into that and talking a little bit about what you're doing at OPQIC, tell us about Barbara. Where did Barbara go to school? What got you into this field and so forth?
Well, funny. So I grew up in Texas.
We won't hold it against you. We like folks in Texas.
They
need to fix their roads, though. I will tell you that. Just driving back, they do need to do that.
I actually got my bachelor's degree from the University of Texas Health Science Center at Houston School of Nursing. And when I graduated from nursing school, I had an internship in Houston and worked in different areas. And labor and delivery was the place that I decided I wanted to stay, and moved here. That was 39 years ago that I became a nurse. Moved here shortly after I graduated from nursing school and started working at OU Medical Center. It was called something different back then, but it was a passion of mine that it was such a privilege that we could be a part of launching families. And really what I did as a nurse made such a huge difference in all of these families' experience of childbirth and how they then launched out into the world as a new family. And I did get my master's degree at University of Oklahoma, so you don't have to hold it against me for getting
a good one. That's a good one.
Going to UT. But yes, I worked in labor and delivery for about 22 years, and then had some overlap, but came to work in this office where it was called the Perinatal Continuing Education Program then, and we work with all of the hospitals in Oklahoma that deliver babies. My predecessors began this work in the 80s. So we've been working with the hospitals for a long time. We have a good relationship with them. We know them all well, and it serves us well to have that relationship of trust and credibility.
So we hear the term perinatal for folks that don't deal in the jargon every day. Explain to folks, when we use the term perinatal care, what does that mean?
So perinatal means surrounding birth.
Okay.
So it really means during pregnancy and postpartum. And we're talking about both the mother and the infant.
Very good. And so the work of OPQIC, as you just said, began many, many years ago. So what was it at that time, if we were to step back in time, what did the landscape look like in terms of good perinatal care? How was our state performing, and what was the interest to want to create a collaborative like this to really put a spotlight on it?
Well, back in the 80s, things were very different. And my predecessors began working with hospitals thinking maybe it would be helpful if we could help provide education from one source so every hospital doesn't have to do it on their own. At that time, I believe there were 124 hospitals in Oklahoma that delivered babies. So that was a lot. That's compared to 43 birthing hospitals today. So they began just providing that centralized education so that we had standardized education. We were pretty much one of the very first states to do this. My mentor, Dr. Warren Crosby, began this work. And that was something that served us well so that every hospital could depend on having evidence-based information. And it was kind of guidelines for care that we could all practice using similar standardization of care that wasn't really a thing back in the 80s. Every hospital just kind of did their thing. So that was a very good way for us to get on the board where we really did have standardized care across the state.
And that leads to the best practices that we use and deploy and the evidence-based and so forth. And so that's what started it all. Mm-hmm. So now we kind of roll the clock, and where we are today. How much change have you seen during that period and the good work that you've seen during that period over 30 some years? Yeah.
Well, starting back then, we started working with the hospitals and continued that work. And in the healthcare landscape 25 years ago, back in around 2000, was when all the work came out, like with talking about safety in healthcare and is it safe to go into the hospital? And publications from different organizations, the Institute for Healthcare Improvement and things like that. So perinatal care was a big piece of that because it is the number one reason for hospitalization in the United States is the birth of a child. And the newborn care. There's about 4 million annual births in the United States every year. So in Oklahoma and across some states, California particularly, started thinking about quality improvement as when in the early 2000s, that was where healthcare started to go. We need to think about quality and how can we improve the quality of care that we're giving. And can we measure the care that we're giving so that we know whether we're meeting quality outcomes? So we started working on that, following really some of the work that they've done in California, creating different bundles and measures and things like that. So the first thing that Oklahoma did as a quality improvement initiative began in 2009. And that was to eliminate early elective deliveries. That was our very first statewide.
And for folks, early elective deliveries are when folks induce their labor and
schedule a C-section
as well.
Without a medical indication prior to 39 weeks. At that time, we had in Oklahoma, before we started our work, we were having about 6 babies born every day in Oklahoma by an early elective delivery. And some babies aren't quite ready to be born yet, and they had an increased risk for complications. When we ended that first collaborative after about 3 years, we were having maybe 3 babies born. Well, it was 1 baby every 3 days by an early elective delivery, according to our data. So we had great success at 96% reduction in those types of births. So that was our very first initiative that we had, and that really benefited mothers and infants.
And do you think that work also helped to be, a demonstration of leadership to the rest of the country when they looked at the success of what you've been able to achieve in doing that?
Yes, we were one of the very first, probably 10 at that time. There were about 10 collaboratives that were doing work like this, and that was pretty much what we all were working on first. And at that time then, there were some reports that came out about maternal mortality, maternal deaths. The United States the CDC hadn't published a rate for many years, and we weren't really noticing that. You hear the term, we measure what we value and we value what we measure.
Right.
Well, people weren't thinking about deaths of mothers. And so Amnesty International came out with a report in 2010 that showed that the United States was the only developed country with a rising maternal mortality rate. And we still have a rising well, it's decreasing because we had an increase with COVID, but we still have one of the highest maternal mortality rates in the world for developed country. So we started looking at mothers and why are mothers dying? Why can we prevent these deaths? And so that really became an area of focus as well.
So if you look at, so we've seen success, and certainly there's more to do. If you were to step back now and look at it, what are the focus areas today? What are some of the particular challenges that we experience today? We've got a lot more data than we've ever had before. We've got the focus on quality and outcomes, patient safety. What's left on the table that we need to be focusing in on and that we are focusing on?
Well, when we look at the data for contributing factors for maternal mortality, the number one contributing factor was hemorrhage. So there's a group, the Alliance for Innovation in Maternal Health. It's a national group, launched in about 2015. We were the first state to join in 2015, Oklahoma. And so we started working with our hospitals on these maternal safety bundles. You may have heard
Explain a bundle, because some folks may not understand it. Again, it's our jargon, right?
Right.
We need to have one of those big fish tanks here, so every time we use a jargon or, we put a penny in it and give it to the foundation.
There we go.
Yeah.
So a bundle is when you have a number of care practices that all need to be done together. So if one piece of the care practice is left out, then you may not have the success that you would if you have all of the pieces of the care practice. So the Council on Patient Safety and Women's Healthcare developed these maternal safety bundles. The hemorrhage and hypertension were the very first one. And we began in Oklahoma implementing those maternal safety care bundles in our Oklahoma birthing hospitals that almost all of our hospitals joined to participate in this work. For example, with the hemorrhage bundle, do you have a hemorrhage cart? Are all of your supplies together so that if you have a hemorrhage, increased bleeding after birth, all of your supplies are in one place?
Just like a crash cart you have for a cardiac event, you do the exact same thing.
Correct. So now OB units have hemorrhage carts. When you think 10 years ago, we didn't do that. For hypertension, if someone has a severe blood pressure reading, we need to treat that quickly within 30 minutes. So are you treating severe blood pressure within 30 minutes? So those were pretty much the first 2 bundles. We decreased our what's called severe maternal morbidity. So those are different measures that we look at that determine that someone experienced severe consequences during childbirth. For example, they need more than 4 units of blood, or they have to be admitted to an ICU or something like that. So we decrease those numbers by 25% with the implementation of those two bundles. So had a great amount of success, and that's continuing today. Right now, when we look at our preventable causes of death and preventable causes of morbidity, there's still hemorrhage is still one of them, and sepsis is another, infections. So we're going to be working with hospitals on implementing a sepsis bundle for obstetric patients. Another leading cause of death is cardiac conditions, cardiomyopathy. Those tend to happen after the mom goes home.
But what we have these, this approach when they're in the hospital, right, and certainly follow up thereafter. What are we doing, or what is missing in our delivery system of helping moms as they're growing that baby in their womb? Mm-hmm. Because you think hypertension, think of some of these others that a lot of them could be related to diet and everything else that goes into creating the best environment for the baby to grow. Mm-hmm. What are we doing? And if that's not within the scope of OPQIC, what do you see as a focus we need to have as a state?
Well, that's a really good point, because if you are healthy when you become pregnant, you have a higher chance of having a pregnancy without any complications. Right. So what we call pre-pregnancy care, or preconception care is something that is missing, because a lot of women, if you don't have insurance, you're probably not going to the doctor when you may not be going when you're not pregnant.
Which is a really good point. And so for any of our listeners, if you have family members who are uninsured, particularly if they're working and their employer doesn't provide it, Sooner Select is an opportunity for residents of Oklahoma to be able to receive care through the expansion of Medicaid, which the people of Oklahoma supported. So when you look at it, there is coverage available for most everyone, particularly for pregnant moms.
Yes. Because
the state did something even grander than that, and they expanded the coverage for Medicaid, Sooner Select, for moms up to 210% of the federal poverty level, I believe. So there's almost universal coverage for moms and babies when you think about it. So if you don't have it, look for it. You can access that, and I think that's what's important. We need to drive that message home to folks that they shouldn't go uninsured if they're going to deliver a baby.
Yes, and even in between pregnancies, and for up to 1 year postpartum, we did extend coverage of Medicaid to 1 year postpartum also. So you have that insurance coverage continuing. But if you don't go to your county health department, there are county health departments that are expanding their services, and they can provide that care also. So that's a key thing, is to talk to someone before you get pregnant, talk to a healthcare professional, and talk about a plan for when you get pregnant. What do you need to do to be healthy? Quitting tobacco is one of the biggest things that you can do, because that's one of the riskiest behaviors during pregnancy, particularly. Eating a healthy diet, becoming a healthy weight. Those things are goals that, if you can, to accomplish those prior to becoming pregnant, and then to plan your pregnancy if you're able to. Over half of our pregnancies in Oklahoma are what we call unintended. So they're either mistimed or unplanned or unwanted. So, being as much as you can to control when you have a child can be very important as well.
Well, I think also, I think our values in our state is that we want to be able to support these moms. So there's plenty of resources, and it's as simple as asking, and particularly if you have no place else to go, the county health department's usually the first place to start with that. Mm-hmm. If I know it's hard to rank states, right? That depending on how the data works and what our focuses are. But if you were to compare what we're doing in Oklahoma with our peers around the nation, how would you stack that up? And be honest about it. If you think we're doing really well, we should brag about it. If there's more work to do, then we need to lean in on it. So how would you stack us up?
Well, I can tell you, coming from the Hospital Association, the care that we give during the birthing experience in the hospital, our outcomes rank better than those of the United States. And those data are available on the State Department of Health website when we look at severe maternal morbidity.
So when we talk about, the governor talks about wanting to be top 10, when it comes to perinatal care, maternal child health care, we do pretty well then.
We do very well. And then that's, I think, a lot. I'll have to brag on myself and my predecessors, because we have been working with the hospitals. For example, we went to a national conference last week. One of our states has just joined that Alliance for Innovation in Maternal Health in 2024 and are just now implementing the hemorrhage bundle when we did that in 2015, 2016. So those kinds of things, Oklahoma is really proactive. I'm always the type that I'm going to say, yes, we're going to do this. And we will get all of our hospitals to do this, and we are very successful with that generally. And now it's a culture in our state where our hospitals expect this. They expect for us to be helping them do what they're supposed to do to help them provide care that is of excellent quality, that is safe, and that is equitable. Those are our goals for OPQIC.
Well, it's clearly it is something for us to celebrate. And when we come back after our break here at Inside the 1581, we're going to talk about a little bit more about the success of OPQIC. Joining me is Barbara Brien, who is the director of the Oklahoma Perinatal Quality Improvement Collaborative, part of the work group of the Foundation for a Healthy Oklahoma here at OHA. But before we come back, we wanted to just spend a little bit of time with our sponsors here at Cyrano Video, who make this happen for us, and we appreciate the folks at Cyrano. We'll be back in a minute.
Cyrano Video is a next-gen video production and digital marketing solution. Video creation doesn't have to be expensive or time-consuming. We enable you to create all the content you need while ensuring it reaches your intended audiences. Learn more at CyranoVideo.com.
Welcome back to this edition of Inside the 1581. I'm joined here today with Barbara O'Brien, who's the director of the Oklahoma Perinatal Quality Improvement Collaborative, and we've been talking about the great work that Oklahoma has done to be really a national leader in supporting moms and babies. And when we took our little break here, Barbara said, God, I really do have to brag. We really are one of the best. And I told her, I said, you should talk about that. But when we do celebrate the good work, I mean, there's always more to do. And if you look at where we are today, if you could put your finger on one or two things that you really want to accelerate, through our communities, through the work that we're doing in our hospitals, what would that be? If we were looking for the one big thing or the next big thing that we want to focus in on? Well,
I think as we look at the contributing factors to maternal death, I've served on the Maternal Mortality Review Committee in Oklahoma since its inception, and where we review all deaths of someone who's pregnant while they have expired or within 1 year of giving birth. And we see we've made progress with certain contributing factors, but what's out there that's still a major contributing factor and is becoming even more prevalent are perinatal mental health conditions. And
I made a note to talk about that in substance abuse. So go ahead, take it away. Because I think it is something that, we don't necessarily want to talk about, but it's a reality, particularly when you're looking at outcomes, particularly on the substance abuse side too, and postpartum and challenges that moms have. So take it away. That's
right. So that's something that we're right now kind of behind the scenes planning on implementing those two maternal safety bundles together. One of our challenges when you look at perinatal care, so we'll say prenatal care, a woman is coming in to an obstetrician for prenatal care. And I think we've gotten a lot better in the past few years that for all women to be screened, that, when I say screen, that means asking a questionnaire.
Right.
Either they fill something out in writing or they do something verbally, asking them questions and determining whether they have any needs that should be addressed related to some kind of depression or anxiety.
And every primary care physician should do that for all of their patients. So certainly for moms, all the more.
Yes. And looking at, do they use any substances? When I say that, I mean drugs, tobacco, things like that. Right. But so I think we've gotten a lot better that most obstetrician, maternity care providers are screening. But we don't know what to do. In Oklahoma, our resources are not as prevalent as they need to be for when someone has a need for a mental health counselor or for treatment for opioid use disorder or something like that. So it's hard for a maternity care provider to screen and maybe not have a place to send this patient that has a need. And so the providers may be hesitant to screen. But we do.
Because it creates a false expectation that you're going to get the support you need.
Right.
So, if we ask folks to be vulnerable with their physician, we need to make sure that we support that. Which
right.
I'm going to make a note here because we both sit on the quality committee, right, with the Oklahoma Healthcare Authority. That's one of the things we probably should be thinking about, an enhanced payment so that we can make sure that we do have therapists that are willing to really lean in on this issue to support moms.
Yes.
It's just something that I've made a note on that we
probably
talked
need to talk about that on the other committees, but very interesting to think about. And, what services can we provide? Minimally, there's a national maternal mental health hotline that if someone has experiencing anxiety, depression, anything that they just don't feel right or they need to talk to someone, there's a national hotline that's a toll-free number, and they can.
And we'll get that, and we'll have Alex go ahead and get that number from you. And in our YouTube video, we'll put that across the bottom so that they'll have that too.
Okay, and they can be provided with a virtual care provider that's located in their state. So there are places, there are people out there. We just don't know about them. And we're really trying to create the awareness for providers to give all pregnant people and postpartum people and their families, really the entire community. We should all know that there's a resource out there for these people and that anybody can call. It's anonymous. And, if you want to give them your number because you do want to get help, then you can do so. But that is out there for all of our providers. And I think we are really looking at, hopefully we'll be successful in boosting up some of the mental health services that we are able to provide. I'm hopeful that we're going to be gaining some more practitioners in our state so that the OB providers will have someone to provide care to, to do a warm handoff to that can provide that type of service, either the mental health or addiction treatment or some kind of medication like that.
Well, we know we have a need here, right? So I think the resources are there. But there is a real threat right now in Washington that those resources could be eroded. And we ran some numbers just the other day, about $1.67 billion of investment in the work that hospitals are doing. We're not even talking about our physician partners and other extenders here, but just in the work that we're doing is at risk on the federal level. And part of that risk is coverage to 300,000 Oklahomans through Medicaid expansion, or for us, it's Sooner Select. If you just took a moment and imagine what would that look like if we unwound this and it could also include the expansion we've done for pregnant moms and babies that we talked a little bit about. How would you see that impacting the work that you're doing and the momentum and the success and the good outcomes that we've had if we had such a significant rollback?
Well, I can tell you that keeps me up at night.
Me too. And I don't think many folks really have started to unravel what that means when you take healthcare away from folks. And our commitment to, as we started this conversation with moms and babies, we're essentially stepping away from that commitment potentially.
Right. And what moms and babies are the backbone of our society. That's how everything starts. The foundation for adult health is laid during pregnancy, infancy, and childhood. So we have to do a good job at the beginning of life, during pregnancy and infancy, in order to have healthy, productive adult citizens. In Oklahoma, the latest numbers I have are for 2022, that Medicaid covered 56% of our births in Oklahoma. So it's usually a little over half of our births are covered by Medicaid.
And that's pretty characteristic around the country where Medicaid is the largest
it's
payer.
It's higher. In most other states, the average is about 45%. So it is the major insurance provider in most states. And if we look at taking that away, you think about if doctors, if they have clients that don't have insurance, it's how can a doctor practice if they're, when you look at an obstetrical practice, when over half of their patients potentially then are no longer going to have insurance.
It's a really good point because we don't think about the workforce part of this. So, trying to recruit obstetricians and their support teams to come to a state that is no longer in a position of having robust services, it makes it hard. Right. So it becomes this race for the states that are the haves, that have greater wealth and more ability to recruit.
Support those, right?
100%. So our community really is at risk of unwinding in terms of what we've been able to do to build a foundation for success. And,
yes.
I had to ask you that question because I think it's important that folks need to take some time.
The outcomes for pregnancy for the pregnant moms in Oklahoma, if they're not going to have the ability to have prenatal care. So we just talked about when you go to prenatal care and you make changes in your behavior so that you're healthier during pregnancy, then you are more likely to have better outcomes. So it will affect our state at a state level to have our outcomes that we've been improving over the last 20 years. I fear will go in the other direction. And you think about families and the higher rate of preterm birth, the higher rate of infant mortality, of babies dying before their first birthday, the higher rate of babies born with congenital anomalies, and just not being able to access the services they need. It's just going to devastate the work that we've done in our families.
Absolutely. And for a team in the ED to have a mom who presents who's not had any prenatal care, and we know that happens because that really was the way it used to be, and we've kind of overcome that to a much better place in how we deliver early care, hence the work that OBQIC is doing. And that we could be back in that situation again where moms present for the very first time and we have no experience, we have no knowledge, and the mom certainly has not done the things that she could be doing to have the best outcome. We've talked today a little bit about what you guys are doing, which, pat on the back, and because you have done some really cool stuff. And we've had impact. We've had great outcomes. We know where we have some more work to do. And we know what some of our threats are, particularly the funding. But there's something that is starting to resonate with folks here in the last week or two, and that's the unfolding growth of the measles outbreak in Texas. And I know I was just at a rural health leaders meeting in San Antonio with rural healthcare leaders from all across the country. And there were two things they talked about: the measles outbreak, because we're in Texas, but small towns, and the potential cuts to Medicaid. So as we look at this measles outbreak, what does that mean when we hear it in a community or in our schools? Just share with us a little bit about how highly contagious it is, and what are the potential bad outcomes for someone that does. And certainly, we learned of a death, which is unfortunate. But if it's left unabated, and it leaves Texas, the next border is us, because it's already in New Mexico.
Mm-hmm. Yeah. Well, measles is the most contagious disease that we know of. And if you're exposed to it and you don't have immunity, you have over 90% chance of getting the disease. And it has a very long incubation period of 10 days to 2 weeks.
And you can carry it for like 6 months, right?
Right. So there's lots of opportunities. When you think of what could be, I think about what could be happening in Texas right now with people traveling, and, is this going to spread to other places? But, when we think about perinatal care and pregnancy, pregnant women their immune system is not as highly functional as other adults. So they are more prone to get diseases that they're exposed to, and more prone to get severe complication from those diseases. So, what may be considered for many people who get measles not a serious disease, it can be very serious for children, infants, children, and for pregnant people too. So it's very concerning. And for infants, we don't get vaccinated until you're 12 months. So
they're wide open. And
yes.
So if you're sitting here and you've got grandbabies and your children haven't decided yet to vaccinate, hopefully grandparents will be telling them and leaning in. Those of us, our generation that saw the benefits of it, and essentially the eradication of this disease in our country until most recently, it is kind of scary to think about what your grandkids could be subject to.
Right. And so when you think about preconception care, that's one of the things that we think about is vaccinations.
Sure.
And getting, vaccines prior to becoming pregnant. And then there are also other vaccines that women get during pregnancy. Because
and what would be some of those? Because we think when the child is first born, we have our measles, mumps, rubella, right? We get those, and I think they're in a 2 shots still today. You help me.
Yeah, those are at 12 months and 18 months that we get those. But during pregnancy, all pregnant women should get vaccinated for RSV and for flu and for Tdap as well, and COVID. So those are vaccines that are very, it's a very helpful thing for the new baby to have the mom's antibodies that she has made because she got those vaccines. So when the baby's born, they have some protection for the first months of their life before they're able to get the vaccines. So that can be very helpful, and something that we always encourage for pregnancy is to get your vaccines that you need to get before you're pregnant, and then also get the vaccines during pregnancy, and the entire family that's going to be around the baby, that they also need to make sure that they are fully vaccinated as well.
I agree. And also for other vulnerable folks in your family, seniors as well. I remember when I was a little kid and I asked my dad, I remember we used to have the was the polio and the TB shot.
And the smallpox.
The smallpox,
the
yes.
one with the,
I still have mine. That's how we can tell how old we are, right? And so I asked my dad when we did that, what was the one that they gave you the sugar pill with it as well?
That's the polio.
Okay, so
they still do that.
Okay, I remember doing that, and I asked my dad, why do we do this? And he said, because if you don't, you could die. And he said, when I was young, I got diphtheria, and I was incredibly ill as a young boy. And he says, and I had friends of mine who got polio. and they could never walk again. And he says, one day we won't have those diseases anymore. And he was right. We got to that point, and it seems now we've taken that step backwards, and we're willing to accept that we want to bring back some of these diseases, or are willing to accept that it's okay that we don't take it personal to be able to protect our entire community. And that's kind of unfortunate.
Well, it is. And you hear people today, well, not very many children will die from this measles outbreak or whatever. It's like, well, you know what? Every single one of those deaths is preventable. Yeah. And before we had vaccines, we had a much higher rate of child death and infant death because of these things. We've eliminated that preventable cause of death by getting vaccinated. So, when you think about that family and the impact of them, that they lose a child and that death was preventable.
Oh, absolutely. And, it's I get my flu shot every year. And here at OHA, we encourage our team members to get their flu shots. And I've seen my friends go down with it. And I think I've been taking the flu shot since it was first recommended. Mm-hmm. And I can't remember the last time I had the flu. Mm-hmm. And same thing with COVID. Being in and around this, it wasn't until I was overseas that I finally contracted COVID while I was on a mission trip. And it's bizarre, but they work, and hopefully more folks will take this, particularly those that are now concerned about this measles outbreak, because it does have the potential of rapidly growing, and certainly we're on the border here. Mm-hmm. So, Barbara, thank you for joining us today in this edition of Inside the 1581. We've been celebrating and learning about the achievements of the Oklahoma Perinatal Quality Improvement Collaborative with Barbara Brien, who's the director of that program, which is now a program embedded in the Foundation for Healthy Oklahoma here at the Oklahoma Hospital Association. We'll put up that 1-800 number for moms who are in need of some support, both behavioral support as they're going through their pregnancy. And we encourage anyone who's listening that has a family member or a friend that is pregnant and they don't have healthcare coverage, please check out Sooner Select as an opportunity for you to access and find coverage. So as we wrap up, I just want to thank Barbara for joining us and those of you who are listening in to this edition of Inside the 1581. But before we go, I want to extend again a big thank you to our sponsors at Cyrano Video who make this happen. We appreciate their support of OHA and Inside the 1581. And Alex Taylor, who makes this happen. He is our producer, both on what we're doing here on our YouTube channel and also on our Spotify and Apple podcasts. And again, also Susie Wallace, who's our Vice President of Strategic Communications. Susie helps keep everything moving here at OHA as it relates to our communications. And I also want to mention our music again that we use from the track Gunslinger by Ends of the Earth. We appreciate being able to use their music as our soundtrack to Inside the 1581. So until next time, which will be 2 weeks from now, we hope you will enjoy the show and we'll share it with your friends. And we look forward to meeting with you again on another edition of Inside the 1581.